my wonderful professors. Today I will be discharging a patient, so I'm just going to give you a little rundown in my office before we go up and meet him. So today I will be discharging a 69-year-old male. His name is Arthur Cheeto, and he suffered a stroke. So he came into the emergency room. His son brought him. He was having difficulty finding his words. And his son noticed confusion as well as slurred speech from his father. So they brought him into the emergency room. We suspected a stroke, so we took him right to MRI. He got a CT first, but nothing was found. No bleeding was found. So later on we did do an MRI and they found multiple emboli in his right hemisphere. When he did come in, he was in AFib and he had uncontrolled hypertension. It was 184/123. No thrombolytic therapy was taken because of that time frame to be given, as well as they didn't do any interventions in the cardiac catheterization lab. So the main goal was to keep him stable. It's a little past medical history. This patient does suffer from hypertension, hyperlipidemia. He does have depression. He is a chronic alcohol user, so alcoholism and atrial fibrillation. The patient stated that 1 year ago, he stopped taking all of his medications. He stopped going to the doctors. He stopped lab work. So we really think the doctor said that this stroke was mainly due to a cardiac embolism. So the patient is in that atrial fibrillation. And with that blood pooling over time, it can release clots, which sadly traveled up to his brain, creating this ischemic stroke. So he does suffer that left-sided weakness. We will see he has weakness in his left leg. He is using a cane. His left arm is contractured. We will see that also. They tried to do passive range of motion, the muscle relaxants, but nothing stopped that contracture from occurring. He does have that homopsia or homonopsia. You know what I mean, the same side vision loss, so he can only see through his right side. So education today is very important with safety, medication compliance. His daughter's name is Skinny. She will be here today. She has told me that her dad is a little bit stubborn, but we just really have to focus on that education today. So let's make our way up there.
Come in.
Hello, Mr. Cheeto. Hello, Skinny. Are you ready to be discharged home?
Yeah, I'm ready to get home. This is my daughter Skinny. She's about to take me home.
Alrighty, let me just do some hand hygiene and we can do some education and you'll be on your way. Let's begin, Mr. Cheeto, so we can get you out of here. So you are aware that you had a stroke, right?
Yes.
Okay, do you know what a stroke is?
No.
Do you know what a clot is?
Yes.
There was a clot. We think it was from your heart. Have you ever heard that you have an abnormal rhythm in your heart? It's called atrial fibrillation. Have you heard that before?
I've heard of the term.
Okay. That irregular rhythm in your heart caused a clot to come out and go up to your brain. So what happened was that clot got stuck in your vessels in your brain. It led to no oxygen to that part of the brain. So that's why you had your slurred speech. That's why you had your difficulty finding your words, okay?
Okay.
All right. So that is what occurred. It was an ischemic stroke, meaning no oxygen. That is why you are having that left-sided weakness. Now, this was on the right side of your brain, which this is just a little educational moment for you. So the right side of your brain controls the left side of your body, and the left side of your brain controls the right side of your body. So you had a stroke on the right side of your brain. So now you have left-sided weakness, right?
Yes.
And how your arm is contracted?
Yep.
That is from your stroke, okay? Also, you can only see, you notice how you can only see the right side vision in your eyes?
Yeah.
So that is also from your stroke. So we will go over some things to help you overcome some of those deficits that happened during the stroke, okay?
Okay.
Do you guys have any further questions so far?
No, get this over with.
I have a question. Yes, Skinny? How did the body compensate for this no oxygen in the brain? Well, Skinny, that's a great question. So, the brain cells in your body, if there's no oxygen, the brain cells die really quick. And you can't get brain cells back, it's irreversible. So, that is why we're thankful that Mr. Cheeto's son, your brother, immediately brought him to the emergency room so we could do those interventions to stabilize him. So, now, Mr. Cheeto, we're just gonna go over some medications, okay?
Okay.
Now, you told me that a year ago you stopped taking all your medicines, right?
Correct.
So, really, it is all obviously your choice. You are the patient, you control your own body. However, it is super important that the medications we send you home with today, you continue to take them and you continue to monitor yourself, okay?
Okay.
Alrighty. Let's begin. Skinny as well, if you have any questions during this, you just ask me, okay? Okay. So, Mr. Cheeto, the first medication we're going to talk about is a blood pressure medication. You suffer from high blood pressure, which a lot of people do. It's a common thing. So, what we're putting you on is a blood or a medicine that will help lower your blood pressure to decrease that risk of having another stroke. This blood pressure medication is called an ACE inhibitor. You will see it as lisinopril from your pharmacy. Some other brand names are like Zestril. You'll be taking only 10 milligrams, which is a low dose. We want to start you out to just see how your body reacts to this. Like I said, it will decrease your blood pressure. It's going to block a certain receptor in the body that increases the blood pressure, so we don't want that. In this scenario, we just ask that you take it in the morning. You can take it with other medications and you can take it with food or without food. I recommend just taking it during breakfast, just it's easier to remember. Some side effects. So one we really talk about, it's called orthostatic hypotension. This is really, have you ever stood up and all of a sudden you get dizzy and see stars in your eyes?
Yes.
This is kind of what that is. So what we recommend is just slowly rising from position. So in the morning when you wake up, just slowly sit up instead of right to standing. Maybe dangle your feet off the bed just to kind of get that sort of, so your body can compensate for you getting ready to stand up. But if you do stand up and you're really dizzy, just sit back down and give yourself some more time. This medication can also cause a dry cough. So a dry cough can be annoying and we don't want that. So if you do find yourself having that dry cough, just contact your doctor and we'll be able to change that medicine up for you to try a new kind. So also we worry about something, it's called angioedema, which is swelling of a certain part. This is if you have any difficulty breathing or your throat feels like it's getting tighter, it's harder to breathe, just go to your nearest hospital and we will immediately discontinue that medication. Like I said, you'll be taking 10 milligrams in the morning. Now, I'm going to ask you a true or false question to see if you're paying attention, Mr. Cheeto. But do you take this with food or without?
With food.
Okay, you can take it with or without food. So I just wanted to make sure you're listening, okay? The next medicine is called Lipitor. So this is a statin. So what this does is it lowers your cholesterol. You do have high cholesterol. It's called hyperlipidemia, but we'll just call it what it is high cholesterol. What this does is exactly what it said. It helps lowers the cholesterol in your body. Now, one thing you do need to remember is you need to take this in the morning without food. So before breakfast, without food and other medications that you're going to take. I recommend as soon as you wake up in the morning, set an alarm, take your statin, take your Lipitor immediately when you remember. And with this, we're also going to monitor your cholesterol levels. So you'll be getting some blood work done just so we can see your cholesterol panel. Now, you'll be taking 20 milligrams by mouth. So just a pill in the morning when you wake up, no other medicines with it, and no other food as well. Now, when did I say to take it?
Right in the morning.
Okay. So right when you wake up.
Yep.
Don't forget it, okay? Next one we're going to talk about is an anticoagulant. So in our terms, this is just a blood thinner medication, okay? You will be taking is called warfarin. You'll also see it as Coumadin, okay? And you'll be taking 2 milligrams, a 2 milligram pill, alrighty?
Alrighty.
So during your hospital stay, we had you on a medication called heparin, and that was a blood thinner as well. But we give people warfarin when they're discharged just because it's easier to take. Recommend just taking this in the morning. Make sure you remember to take this. Don't discontinue it at any time. If you do have any concerns, you need to call your doctor. Like I said, this thins the blood out. You have that AFib, what we talked about earlier, that irregular rhythm of the heart. So the reason we want you to take this blood thinner is so if you are in AFib, clots won't be able to form because your blood is thin. So that decreases the risk of having a stroke. With this medication, a side effect, kind of an adverse effect, is bleeding because your blood is thin. So if you see blood in your urine, in your stool, you see your gums are bleeding or your nose is bleeding, just call your doctor so we can adjust the dosage, because an adverse effect is bleeding and we don't want you to bleed out. That is not what we want. With this medication, you will need to get your blood work taken. We have already scheduled the next few weeks for you, so you don't have to worry about scheduling. Usually it'll be weekly and then bi-weekly and then monthly. We're just looking at one of those lab levels to make sure that you aren't at an even more increased risk of bleeding, or what we call hemorrhage. Next medication, it's called a muscle relaxant. So you see how your left arm is contracted, how it is up like this, kind of?
Yeah.
That's from your stroke. So with a muscle relaxant, this is called baclofen, also known as gabapentin. You'll be taking it 5 milligrams 3 times a day, okay?
Okay.
So I recommend taking it at breakfast, lunch, and dinner. So with some side effects, you might get a little dizzy, drowsy, unsteady. You might have some vision problems. So with this, I really recommend taking it the first few times to see how your body reacts. Now, this doesn't mean take it and immediately go drive your car. Just give it a little time to see what your body reacts, how it reacts to this medication. This is just to prevent it's called muscle spasticity, so that rigidity in your arm, just to kind of loosen it up. Now, when you were here, that muscle contracture, we were trying to do range of motion on you, even though it was very weak, but your muscle did just contract. So that is why we're giving you this medication. Now, you can take this with food or after food. So how many times a day are you going to take it?
Twice. 3 times.
3 times a day, okay. So after or during?
Breakfast, lunch, and dinner.
Okay, great, perfect. Alrighty, and the last medication we're going to talk about is your antidepressant that we're going to give you. Now, Mr. Cheeto, how long have you suffered from depression?
10 years.
Okay, and have you ever been on an antidepressant before?
Nope.
Okay, so the antidepressant you're going to be on, it's called Prozac. You may also hear it as fluoxetine, but mainly Prozac. It's very common. We commonly administer it to patients who need it. This will kind of treat your depression symptoms, sort of masking it kind of. It's going to increase those happy transmitters in the brain. So you're going to feel a little better versus some of those days that are harder to get through. Some side effects, oddly enough, a side effect is depression. So it's not going to work immediately. So Skinny, I want to tell you, you do live with your dad, right? Yes. Okay. So if you hear your father saying anything sort of abnormal relating to suicide or ending his life, you need to take him to the nearest hospital, contact us so we can keep an eye on him, because safety is the number one key in this situation. Other side effects are insomnia, nausea, nervousness. These are normal. However, if it is like bothering you to the max, you call your doctor and we'll find other ways. Something to remember with this medication that you might not like is you need to avoid alcohol. This will increase the adverse effects, which is something we do not want. And another thing is to take in the morning. so you can take this with your other medications. A side note is with this antidepressant, you're also taking warfarin, that blood thinner medication, and Prozac, the antidepressant, can increase the risk of bleeding with warfarin. So that is why, Mr. Cheeto, you need to make sure that you're complying with going to get your blood work done so we can closely monitor those levels. It's called INR, that's the level we monitor, to make sure you are not at an increased risk of bleeding. Okay, Mr. Cheeto, I'm just going to ask you questions about your medications. Okay, so your blood pressure medication, what is something to remember?
I need to sit up slowly.
Great. We went over all your medications, all of the side effects, and the dosage that you are prescribed. So as I said before, medication compliance is a huge deal to reduce that risk of stroke, because once you have a stroke, you're at increased risk for another stroke. Sometimes with a right-sided stroke, you can maybe forget those limitations you have. So Skinny, at any point, just try to reorient your father. Just remind yourself, I did have a stroke, so being careful we don't need you falling with that left-sided weakness. So we did schedule home health physical therapy for you. I'm not sure how many times a week they'll come in, but they're going to come in and you're going to go over exercises that strengthen that left side. Now, I'm not saying that the strength will completely come back, but physical therapy and occupational therapy coming to your house is definitely going to benefit you in the end. I know that you like your alcohol, so how many drinks have you had a day usually?
Usually about 6 to 7.
6 to 7, okay. And how long have you drank alcohol?
For about 25 years.
25 years is when you start drinking every day?
Yeah.
Okay. Have you ever thought about quitting?
Not really.
Okay. So with this diagnosis you have and some of the medications that you're given, alcohol can't really be in the subject. So I'm going to give you some papers of support groups you can go to. Stopping your drinking is a huge consideration for this to decrease the risk of any sort of adverse effects or further damage to your body system, such as your stroke.
You wouldn't get it, lady. I ain't quitting.
Well, I understand your frustration, especially since alcohol is kind of your coping mechanism with things, but just really consider what I said about your alcoholism. So next we're going to talk about the signs and symptoms of strokes. So Skinny, I'm talking to both you and Mr. Cheeto. This can be Mr. Cheeto having signs, or someone in your family, or just a friend even. If you see these symptoms, it's probably a good idea to get medical attention. So we use the acronym B FAST. So B is for balance. If you see someone off balance, if they're stumbling around a little bit, further investigate that. Eyes, they may complain of blurry vision or seeing double, so that's called diplopia. F is face. You can see facial drooping, facial weakness on one side of the face. That is a common thing. So maybe ask, if you see this, ask the person to smile, and they may not be able to smile because they're having that droopiness on one side. A is for arm. So they could have arm weakness. So you could tell them to hold their hand up, but they might not be able to. They might be like this. So that's also a symptom. And then S for slurred speech, just like Mr. Cheeto had. So how he was slurring his words, having difficulty finding his words. All of those symptoms lead up to, okay, time to go to the hospital. And what we say is time is brain. We need to treat as soon as possible because those brain cells, irreversible once they don't have enough oxygen and they die. With that right-sided stroke, sometimes the patient may neglect their left side. They kind of forget about it. Even how your vision is, you can't see that side, so you kind of get used to and forget about it. So we want to make sure we're taking care of the left side of the body. Skinny, you can remind your dad, hey, look in the mirror, Dad, so he can see his left side. We also want Mr. Cheeto, we want you to scan the entire room before walking in a room or walking out of a room, just so you don't, just safety precautions. Just make sure you're scanning everything because you might run into a door and not even have seen the door because of those aftermath of the stroke where you can't see out of that one side of both of your eyes. Mr. Cheeto, can you show me how you would scan an entire room?
This is stupid.
Mr. Cheeto, it's just a safety precaution. I don't want you slamming into a door and then ending up in the hospital again. I know you don't like the hospital that much.
Damn straight.
Skinny, with this deficit in that left side of his vision, just make sure you tell your family to approach Mr. Cheeto, your father, on the side he can see. So on his right side, approach him from his right side. Lastly, we're just going to go over some lifestyle changes. So you are taking that medicine that lowers your cholesterol. However, you also need to have a low cholesterol diet. This includes your red meats, dairy such as cheese and eggs, so more of the animal foods. Also, some low cholesterol diet, it includes like oats, nuts, and fish, as well as some high fiber foods. And then we also want you to decrease your salt intake. This has a lot to do with high blood pressure, and even the slightest, we say about 2 grams per day of salt, to avoid things like canned fruits and vegetables, those frozen meals.
So you're telling me I can't eat my steak?
You can eat that stuff, but kind of take it in moderation. So don't eat it every day. Maybe eat it once or twice a week. That is recommended. But do you two have any questions for me?
No, ma'am.
You ready to go home?
Hell yeah.
Let's go.